If you've been avoiding bunion surgery because of what you've heard about the recovery, you need to hear this. Your surgery you're picturing doesn't exist anymore. I've had patients come to me who've waited 8, 10 years because of what they were told by a primary care doctor, by something they read online, by a family member who went through it decades ago. By the time they came in, the deformity had progressed way beyond what it needed to be. The procedure took about an hour. They walked out of the building the same day. In this video, I'm going to walk you through exactly what this fear is based on and why it's outdated. I'm going to show you what bunion surgery actually looks like with a modern technique and what it cost you to keep waiting. By the end, you'll have a clear way to evaluate whether the decision you made years ago still holds up with the current information. Let's get into it. When most people imagine bunion surgery, they're imagining a long incision on the side of their foot. The bone is manually repositioned. The patient sent home in a cast. Recovery in that model meant no weight bearing for weeks, crutches, muscle atrophy, a return to normal activity measured in months, 2 months, sometimes 3. It was real. And people talked about it. Those people told their daughters, their coworkers, their neighbors, and the story became the reference point. And because surgery isn't something most people do more than once, the story never got updated. The person who heard it in 2003 is still carrying it today. That technique isn't what the most skilled surgeons are using now. Surgical approaches evolve, the tools evolve, the understanding of how the foot heals evolved. What the old techniques required isn't what the modern technique requires. The cast and crutches recovery that's stopping you from having the conversation, it's based on surgery many skilled surgeons have moved away from entirely. You're making a current decision based on discontinued experience. This isn't a critique of anyone who went through that recovery. It was standard of care at that time. This is an update. The techniques change. The recovery changes with it. And the fear, because it's based on stories that predate this change, no longer maps onto what this procedure involves today. With minimal invasive techniques, the approach changes completely. Small access point, poke holes in many cases, not a long incision. Advanced technology has allowed precise repositioning through openings that used to require full exposure. In many cases, no external stitches. Same day walking, not walking eventually, walking before you leave the building that day. The recovery model is active, not passive. Early weight bearing, early range of motion, intentionality, because your body heals faster when it moves. Return to normal activity as early as 10 days. That's not best case outcome. That's what the approach is designed to produce. I've had patients come in for bunion procedures in the morning, walk out in the afternoon, and they tell me after that the experience was nothing like what they expected. The gap between expectations and reality, entirely a product of outdated information. When you update the information, the question changes. It's no longer, can I tolerate months of recovery, because months of recovery isn't what's required. The question becomes, is 10 days of adjusting activity worth years of pain and progressive worsening? But there's a second problem with old technique that doesn't get talked about enough, and it explains why so many people who had bunion surgery years ago end up needing another procedure. Most surgeons who perform bunion surgery have done a small number of them. The approach they use is the one they know. Correct the visible deformity, make the foot look better. Close it up, the bump is addressed, done. A bunion isn't just a bump. It's a structural misalignment driven by an underlying mechanical cause. If you correct the bump without addressing the cause of the drift, the cause doesn't go away. The one-size-fits-all correction doesn't change the underlying mechanics. Over time, the deformity returns. The pain comes back. The patient is looking at a second procedure or living with a result that was never fully resolved. One of the things actively harming patients in this field is that the surgery appears to fix the bunion but doesn't address why it formed. The patient wasn't failed by surgery itself, they were failed by the limited approach to surgery, and because they experienced a different recovery and an outcome that worsened. They tell others, the surgery doesn't work. This story gets added to the pile. More patients stay away, more deformities progress. A proper bunion workup starts with a diagnosis, identifying not just the deformity, but the underlying cause. I know 5 or 10 approaches to most of the conditions I treat. The goal isn't to make the foot look better. The goal is to correct the root cause so the problem doesn't come back. The fear of the procedure that won't hold, they require another surgery down the road, that fear is specific to a specific approach. A diagnosis first, root cause approach is a different proposition entirely. If what I'm describing is giving you a different picture of what bunion surgery actually involves, subscribe so you don't miss what comes next. There's more to cover on recovery and the planning process and what to look for in a surgeon. Subscribe and you'll have it. I want to ask you a few questions, actual questions. One that you can answer right now in your head while you're watching this. Have you changed your shoes you buy because of this? Have you stopped something physical, a sport, a certain distance of walking, because of what happens to your foot when you push it? Have you had a moment more than once where you thought, I need to deal with this, and then that moment passed and you didn't? How long ago did you notice the bunion? How many years has the answer to when are you going to do something about this been eventually? What would you be doing right now if your foot weren't a factor? Those questions are designed to make the cost visible. Avoidance is a decision, and like every decision, it has a cost. The cost isn't just pain, it's progressive structural worsening, activities lost over years, and a deformity that becomes more complex to address the longer it's left alone. The patient who comes in a year or two is in a different position when that patient comes in 10 years. The procedure is more straightforward. The recovery is more predictable. The outcome is more complete. The years between 2 and 10 of unnecessary accommodation. So what actually changes when a patient comes in with current information and makes a fresh decision? Here's what I see when patients walk in who've been living with a bunion for years and finally come in with an open mind. The first thing that changes is the fear. Once they understand what the procedure actually involves today, minimal invasive, same-day walking, back to activities in 10 days, root cause addressed, the mountain they built reduces to something proportional to the actual undertaking. The second thing that changes is the timeline. When they're no longer waiting for pain to become unbearable, they can make a decision based on an actual trade-off. One well-performed procedure now versus ongoing pain and progressive deformity indefinitely. I've had patients sit across from me and say, I can't believe I waited this long. Not because the procedure was trivial, because the gap between what they imagined and what was actually required was so large. They felt like they've been making decisions about a completely different surgery. They had been. The information they had wasn't current. Stop using what someone else went through 10 or 20 years ago as a reference point to what your recovery will look like. The experience was real. It's not predictive of your experience with modern techniques. Get a diagnosis, not a consult to schedule surgery, a diagnostic conversation to understand what's happening to your foot, what's causing the deformity, and what a current approach looks like. That conversation doesn't commit you to anything. It gives you accurate information to make decisions with. You've been making this decision with outdated information. Get current information. It's the responsible thing to do. And there's one specific thing you can do tonight before you close this video, before you make any calls, that will help you understand exactly where you stand. Most people don't make the call because the discomfort on any given day is tolerable. The threshold for action is unbearable pain. And with the right shoes, the foot is merely uncomfortable, so the call gets deferred. Think of it like this. A slow leak on a tire. Any given day, the car drives. You know about the leak. You've been monitoring it. And because the tire hasn't gone flat yet, the repair stays on the list. The leak isn't waiting for your schedule. When the tire loses pressure and finally goes flat, it goes flat somewhere inconvenient at a cost higher than the repair would have been. A bunion is a slow leak. The deformity is progressive. The accommodations are compounding. The activities lost are being accumulated. And the surgery you're afraid of isn't the surgery that exists today. Tonight, if you want, do 3 things. First, look at both feet side by side and notice how much the alignment has changed since you first noticed it. Be honest about what you see. Second, write down one activity you stopped doing or reduced because of your foot. Just one. Write it down. Third, ask yourself, if the recovery were 10 days and you were walking the same day, would you have had this procedure 2 years ago? If the answer to the third question is yes, then the decision you've been making is based on a surgery that no longer exists. The right conversation has been waiting for updated information. That information is now yours. Every patient who sat across from me after years of avoidance has some version of the same thing. I wish I had come in sooner. Not because the procedure was easy, but because the obstacles that kept them from the conversation wasn't what they thought it was. The obstacles was information that hadn't been updated. That's a solvable problem. You just solved it. If you want to see exactly what modern bunion surgery looks like, the procedure, the recovery, what to expect day 1, day 3, day 10, the video you're really waiting for is called, Can You Really Walk the Same Day After Bunion Surgery? What actually happens in our practice. Watch it next.